Well, good afternoon, everybody. My name is Greg Olsen, and I'm the director of the New York State Office for Aging. I am really pleased to have what I think is a really fantastic program at exactly the right time. I'm joined today by Heather Leddick, who is our state's HIICAP director and oversees a large network of volunteers and paid staff to help individuals, but we're going to talk about that in a second. And my good friend, Frederic Riccardi, who's the president of the Medicare Rights Center. You know, you can't flip on a TV anytime starting in August and beyond without seeing some type of ad for the open enrollment period for Medicare to either choose a new plan or change a plan or what have you. But we're not in the selling of a particular plan business. We sell objectivity and information so that individuals can make the best choices for themselves. And we have two great experts to talk about that today. So Fred, Heather, welcome. I'm so glad that you could join me today.
Thanks, Greg.
And
thank you, Greg,
Heather,
for having us here.
Oh, my pleasure, Fred. Let me just jump in with you first, Fred. Tell us what the Medicare Rights Center is and what it does.
We are a nonprofit organization where we help people with Medicare, older adults, people with disabilities, navigate the Medicare system. We help them with any issues they have with drug plans, Medicare Advantage plans, and we help them afford their costs.
Yep, and we're going to be talking a lot about that today because it's complex. There are many, many plans. Many of them are different, and people don't know where to go, and sometimes get steered in the wrong direction. So, Heather, again, you're a New York State Office for Aging employee, but you specialize in what's called the HIICAP program. At the national level, it's called SHIP. In New York, it's called the Health Insurance Information Counseling and Assistance Program. Tell us what HIICAP is.
So thanks, Greg. As you mentioned, yeah, HIICAP, Health Insurance Information Counseling Assistance Program. And really what we do is help Medicare beneficiaries. We help Medicare beneficiaries, we help their caregivers, family members, anybody calling in need of assistance with Medicare coverage. And there's a lot that goes into that. And the reason I say that is, you know, Fred mentioned some of it before, but it's really everything. So it could be a claims billing issue, it could be an appeal, it could be prescription drug coverage, choosing a different plan, which is what we'll get into today with this open enrollment period we're in. But across the state, we've trained and we have over 650 counselors available to assist Medicare beneficiaries calling into the 1-800-701-0501 number. That's how you reach HIICAP. Once you call in, you'll be asked to say your county name, and then you'll be routed right to your area agency on aging and your local HIICAP program. So there's a lot that we provide Medicare beneficiaries. And again, you know, I can't emphasize enough, Greg mentioned it before, but free objective information. So we're not selling a plan or a product, we're helping you understand your health insurance benefits.
So Heather, for you, because you just talked about the huge number of paid and volunteer staff. And again, for all the volunteers out there, I have to, again, just thank you for your service. You know, whether it be the long-term care ombudsman program or HIICAP, those are very, very complex, and you giving of your time makes it happen that people can really navigate a very, very difficult landscape. But you talked about the phone number. Are there also ways, because you know, what you oversee covers the entire state of New York, right? And we've been working with Fred and the whole team at MRC for forever as you know, additional support for the state, but additional support for us as well. Besides the phone, are there ways to talk to somebody in person throughout New York State through the HIICAP programs?
Oh, absolutely. Yes. So really, the basis of our program is that we work with people on a very individualized basis. And that happens through face-to-face, one-on-one counseling with Medicare beneficiaries. And that's offered through the Area Association on Aging. You can give them a call, reach them through our 1-800 number, and then you can schedule an appointment to meet with somebody in person. And that's really, really necessary because this information can be very complex, very intricate, and many individuals prefer to meet in person, although we also do a lot of our work telephonically over the phone with folks.
Yeah, and I want you guys both to answer this because I don't want the folks that are listening today or will be in the coming days to think that you're separate. Obviously, MRC is its own not-for-profit. We're the state, but we have been working together for a very long time. So from both of your perspectives, who can benefit from calling HIICAP or MRC? Like, I don't see it as, well, you have to fit in this particular category. There are so many nuances to Medicare, to billing, to insurance claims, to things not getting paid, et cetera. Who would you say, Fred, would benefit from calling MRC?
Well, Greg, that's a great question. We get calls from older adults and people with disabilities who are on Medicare all the time. But about a quarter of our clients are also family members calling on behalf of somebody with Medicare. And, our helpline is also staffed by volunteers, and our partnership is, so close to every HIICAP county that we often will share information with one another, and we will, assist people at the same time in case somebody needs some local assistance applying for a program to save with their prescription drugs. So there's a deep partnership there. So we help families, caregivers, and sometimes we even get phone calls from physicians and nurses on behalf of somebody with Medicare. So really anybody with a Medicare question can benefit by calling us.
And Heather, what would you say?
Yeah, I'd say the same. And thank you for pointing out, Medicare Rights Center has been a partner of ours for many, many years. We work really well together. And, just as Fred said, anybody with a Medicare question, give us a call. We're going to help you. A family member, a friend. We've dealt with providers' offices just the same. But I also want to say, just to give an example of who can benefit from calling, right? So we had a case just a few weeks ago where you mentioned, Greg, those television ads and turning on the TV and all that information that's coming at people right now during the open enrollment period. And we had a beneficiary reach out a few weeks ago who inadvertently was enrolled in a Medicare Advantage plan. And what happened was she lost her retiree coverage, and that's very unfortunate. And it happens more often than not. A lot of folks are in that situation where they've answered a call or they've called the number on the television, and they've lost their retiree coverage. And that was devastating to her because she had worked all her life for that, and it was very comprehensive coverage. So she reached out to HIICAP at the local level, and we were able to assist the local, and we were able to help get this beneficiary back her retiree benefits and get her out of the Advantage plan. So I just wanted to share that because that just kind of puts it in perspective, some of the work we do and the folks that we can help through HIICAP.
Yeah, and I think that's a fantastic example because absent you, Heather, the network that you oversee, Fred, all of your staff, and your volunteers, absent that service, I don't know what the notification to that individual would have been, but the result would have been entirely different because there isn't somebody that, has the relationships you guys have, understand how that things can be undone if you pull the right levers. So for those of you watching, again, this stuff is not easy. That's why we have Medicare Rights Center, the HIICAP program, and the SHIPs nationwide, because it's extraordinarily complex and you're being bombarded with a lot of information that may be right, may be wrong. We do know that at the federal level, the US Senate is investigating these type of marketing practices. So the best place to go are places that are selling you objectivity. And that's what we're doing. So I'm going to start with you, Fred, on this one. About, 2-3 weeks ago, I read an article in the New York Times that said, there's about 6 million low-income older adults across the country that could be pulled out of poverty just by applying for a couple of programs that their taxpayer dollars have paid for their entire lives. One of them was SNAP, where the average benefit in New York State is $3,000 a year. And the other were the Medicare Savings Program and Extra Help. And I think, just over the last couple of days, we've all valued that in New York at about $10,000 of support. So can you walk through what the Medicare Savings Program is and how somebody might benefit from that?
I can, Greg. And, if 2023 is going to be the year that I will be standing on the mountain behind you and screaming from that mountaintop about this expansion, because Heather and I have seen over the years the difference that this benefit can make. The Medicare Savings Program, it's a public benefit. Someone can apply for this program through the HIICAP, through the Medicare Rights Center. It's processed through the local Department of Social Services. And it can increase someone's income anywhere from 10 to 20% a month because it pays for the Part B premium. Next year, the Part B premium is going to be roughly $165 a month. And if you enroll into this program, you can have that paid for and also have your prescription drugs, the cost of those drugs reduced, to around, $5 to $10 per drug. The income limits are going up. It's going to go up to about $25,000 a year for a single person. That's about $2,100 a month. Even if your income is slightly above that, we encourage you to still be screened and apply for this program because income can be counted differently. And I just want to, thank SOFA, I want to thank the Department of Health, and I want to thank the governor for passing this expansion last year, because in April next year, we're going to see close to 300,000 people, we've done research into this, eligible for this benefit, and we want to get the word out. And you can call HIICAP, you can call the Medicare Rights Center, and we can screen you for the benefit now. You may be eligible now under the current income limits, and next year you may be eligible under the new limits. We've already spoken to 250 people that we have in a queue because we know that they're going to be eligible on January 1st, and we're going to help them enroll.
So you said the Medicare Savings Program, and you're absolutely right to give kudos to Governor Hochul for expanding that. It's going to help a lot more people and provide a larger benefit, but that's a state. You have to apply, get screened and apply, and then the application goes to the county departments of social services. There's something different though called extra help. As long as we're on this topic, can you walk us through that? Because it's a little bit different, similar type of benefits, but different in terms of how you get it.
Sure, and the extra help benefit, that's administered through Social Security. And everyone who enrolls into a Medicare Savings Program automatically gets enrolled into extra help. And some folks just apply directly for extra help through Social Security. Those income limits are more stringent than what New York is doing with the Medicare Savings Program. So if your income is around $1,400 to $1,700 a month, you're eligible to have your prescription drug costs lowered. And the benefit of that is around $5,000 a year on average for everyone who enrolls into extra help. And you can apply through Social Security. The Medicare Rights Center can help you apply, and HIICAP can also help you apply for that. And so what that will do, and it makes a big difference, if someone has a prescription drug with a copay of $100, $200 a month, if you're enrolled in extra help, that copayment gets severely reduced. You're not going to pay more than around $10 for that drug.
All right, that's awesome. So there's those two benefits. So if you are eligible for MSP, the Medicare Savings Program, you're automatically available or eligible for extra help. But there's two ways to apply. If you're just applying for extra help, it's through Social Security. If you're applying for MSP, it's contact you guys, and that application process goes to the Department of Social Services. For those who are watching, Fred's an amazing ventriloquist. I think he was frozen there for a minute, but I'm pointing that out. I thought that was funny, but that was a great explanation.
Thank you,
did not
Greg.
lose any of your audio. Okay.
Greg, can I mention
Heather,
one thing? Yeah, I want to mention one thing for the Medicare Savings Program. The application is pretty straightforward. It's not an overly long application. And if you receive it and you're kind of questioning, how do I complete this? We actually have a walkthrough of it on our NYSOFA YouTube channel. So you could head over there, watch the video along with many, many other videos, and apply for the program.
Yeah, you're absolutely right. I thank you for reminding. We did a whole bunch of video tutorials, and there were a couple on this. So it's a line-by-line walkthrough of what the questions are asking and how you fill that out. Thank you for the reminder on that. So Heather, the timing for this is spectacular. There's something called the open enrollment period, and you'll talk about that in a second. But this is the time of year when people get bombarded in the mail, phone calls, on television, with all this information about either enrolling in a new or a different plan. So talk to us about what open enrollment period means, what those dates are, and what you have to do during this time or not.
Yep, thanks, Greg. So as Greg mentioned, currently we're in our annual open enrollment period, or we like to say our AEP. And what that really is October 15th to December 7th. Anybody who has Medicare coverage can make a change to their coverage. And you may say, what change can I make? I like to tell people, really, you can make any change. So if you have a prescription drug plan and maybe it's not the right one for you, maybe you've noticed that a medication is no longer on the plan's formulary, meaning they're not covering it, or your drug costs are really high, it's time for you to take a look at that and see what other options are out there with prescription drug plans. The same would hold true for a Medicare Advantage plan. A lot of the times we can see changes in provider networks from year to year, and that might mean that you need to make a change to your Medicare Advantage plan. And now is the time to do it during the open enrollment period. So you can pretty much move around and do anything during this period with your Medicare coverage. I want to mention, though, that a Medicare beneficiary should have already received what we call the annual notification of coverage. I believe that's sent out in like late September, and it goes over what your plan is going to offer in the new year. So you should have already received that. And in receiving it, you should evaluate what's the changes. And what I mean by that is, look at what your primary care physician's copay was. Was it $10 last year and now it's jumped to 20? Did your specialist copay go from 30 to 45? Those are good reasons to come in and call us and come in person for a counseling session with HIICAP to review your coverage during this period. And all of these changes take effect January 1st. So that's when, if you do choose a new plan, it would take effect January 1st for 2023. So.
Yeah, so I guess in other words, don't assume that the coverage that you've traditionally had is going to be in your best interest from year to year. Yep. Because there's so many different plans and so many changes, right? Roughly how many plans are there, Medicare Advantage plans in New York State?
Oh, gosh, Greg, great question. Fred, do you recall the exact amount in New York State?
Medicare Advantage plans, dozens. And Part D plans in New York State, there's 19.
19, yeah.
And so people are inundated with advertising and information about plans. And so what I like to also remind people, because I get phone calls from my own relatives, is you may not even necessarily need a plan because you have retiree insurance that provides you prescription drug coverage and provides you secondary coverage to Medicare. And so, it's important for people to understand that they should review their coverage if they're enrolled in Part D, because those list of covered drugs change every year. And there are dozens of Medicare Advantage plans on the market. And so it is really confusing to people to understand whether or not they should switch coverage, change coverage, review, what they have. And so we're here to help people sort that out. One thing that I've noticed over the years is that often HIICAP and the Medicare Rights Center receives calls from people who are in crisis. And they're in crisis because they're enrolled in a private plan, whether it's a Medicare Advantage plan or just a Part D plan, and they can't access the health service or the drug that they need. And we can walk you through the appeals process. But this is also the time of year. If you've had problems in the past, this is the time of year where you can make that change. And so we encourage you to give us a call and review your situation with us.
Yeah, and I just want to dovetail off of that a little bit. So to answer the question about how many Advantage plans, we look at things very county-based. So when we're looking at options for folks, we're using a tool available through Medicare.gov. It's referred to as the Medicare Plan Finder. And that helps us narrow down how many Advantage plans are available in that area. And I was assisting somebody the other day, and I want to say we were up to almost 50 plans in a certain zip code in a certain county. So there's a lot to sort through. That's my point. And we're here to help you do that and narrow it down based on your personal needs, your personal health needs.
Yeah, and I appreciate both your response. That's why I asked the question, because I'm my health insurance plan, the booklet that I get is this big. So now you multiply that by the numbers you just said, and it can overwhelm people into either inaction or to feel like I'm stupid. And that's not the point. This is really, really complicated. As Heather said, there are software tools to walk through to really match up what's in your best interest financially, coverage-wise, et cetera, because it is so complicated. Roger, can you pull up the slide on original versus Medicare Advantage? And Fred, walk folks through. There's still a lot of people on fee-for-service. That's original Medicare. And then Medicare Advantage has been around for a while, and what the differences of those two different approaches are.
Great. And there's some big differences. And, I'd like to, remind people, first of essentially a golden rule. If you have original Medicare and retiree coverage, or original Medicare and something that's called a Medigap, which pays after original Medicare, you typically don't need to make a change. You're good with that coverage, but you should look at your Part D coverage. So for people who are in original Medicare, and everyone who's new to Medicare first is enrolled in original Medicare, the vast majority of doctors and hospitals bill and accept Medicare. And you don't have any referrals to go see a specialist. So if you need to see a cardiologist, or if you want to go to a physical therapist, you don't need a referral from a physician to be able to schedule that visit. But there are some benefits that Medicare still does not cover. Although, we did get close, over the summer to the inclusion of hearing and vision and dental coverage, those services are not generally covered by Medicare. And there's also no limit on out-of-pocket costs. And so when you go to a physician, let's say if the charge is $100, which is set by Medicare, so those costs are set, you're on the hook for 20% of that cost. But you may have other types of coverage that'll pay that co-insurance or the co-payment. That might be a Medigap, that may be Medicaid, that may be your retiree insurance. Now, a Medicare Advantage plan, that's a private health insurance company that is offering you your Medicare benefits. You don't lose your access to Medicare, you're just getting all of your benefits through a private health plan. And so if you've received brochures in the mail, have seen these commercials on TV, most of them are touting the benefits of enrolling into a variety of Medicare Advantage plans. But what you'll want to know is that each plan has its own network of doctors. And even if the same insurance company has multiple plans, those networks can look different. They may only include 2 out of a few hospitals that are available in your area and a number of providers. But they also can provide some additional benefits like dental, hearing, vision. But you'll want to look at the details, like, well, what is covered if I enroll in this plan? Is it more than a routine checkup? Can I get dentures? You want to really look at those details, because what the research is showing is that even though on the surface it may seem more affordable to enroll into a Medicare Advantage plan, those costs can add up, especially if you have a chronic condition, if you fall ill, you need many, chemotherapy or many tests, those costs can add up too. So we're here to help you, sort through this big decision. And fortunately, you do have the opportunity every year to make a decision to switch out of a plan or not. And then in some cases, we can even help you outside of this time too.
No, that's great. I continue to hear the message from the both of you that, like, there's general things that you have here for original Medicare, Medicare Advantage, but you can't cookie cutter because everybody is so different. It is so individualized, and having a specialist like you, Fred, and your staff, and Heather, and most folks may or may not know that we require our HIICAP counselors all to be state certified, so that we're always up to speed on the newest changes, and for public confidence in what we're doing, that it really is individualized. So picking up the phone and starting with either you or the HIICAP network, is the first place to start. So we talked about a lot of, what the Medicare Savings Program was, what the networks do, what you guys are all about, the open enrollment period. But I am sure starting January 1, there are going to be other changes that people need to be aware of. Can you kind of walk through some of those? And Roger, can you pull up that slide, please?
Yeah, there's some good stuff happening in 2023. Actually, Medicare Rights Center, along with NYSOFA HIICAP here, we went out and trained, a very large network across the state in person this year, across the state, 7 in-person regional trainings. And when we did this presentation about all the upcoming changes for 2023, we called it the good news presentation because there's lots of good stuff coming. So one thing that I want to talk about are these two changes here that were outlined. And this is part of what we call the BENES Act, which is the Beneficiary Enrollment Notification and Eligibility Simplification Act. That's a very long name, but we refer to it as the BENES Act. And as part of that, one of the big changes for 2023 is if somebody had failed to enroll in Medicare Part B when they were first eligible, which is in their initial enrollment period. And what the initial enrollment period is a 7-month period surrounding the 65th birthday. So it's 3 months before the 65th birthday, the month of the birthday, and 3 months after. But if somebody failed to pick up Part B during that period, and they were kind of stuck without their Part B coverage, they would enroll in what was called the general enrollment period. And previously in the general enrollment period, if you enrolled between January 1st and March 31st, you can see it on the screen here, your coverage usually began July 1st. But through this BENES Act, this change that will take place in 2023 is your coverage will begin the first of the following month. And that is huge because can you imagine enrolling in Part B between January and March and you didn't get it till July? So now that's no longer, and folks will be enrolled for the first of the following month. The next thing is the new special enrollment periods. Fred, I don't know if you want to, there's a few that were outlined in the BENES Act, if you want to comment on those.
Yeah, I can walk through those. And what's really exciting about this is that some of these rules were in place for 40 years and they're finally changing. And we just want to thank everyone for sharing your story with us and HIICAP around this, because we were able to make this change, together at the federal level. The pandemic has, been particularly hard on older adults who were working. And these changes will impact people who were unable to enroll into Part B, but can enroll on January 1st. And so this is available to help. If someone, maybe kept their COBRA coverage and learned they can't enroll into Part B, we can walk you through this process. Also, too, next year, if someone loses their Medicaid coverage and they don't have a part of Medicare, Part B or Part A, which is the hospital benefit, there would be eligible for a special enrollment period. We hear from so many people who received advice from an employer that, told them, look, you don't need to enroll into Medicare, we have you covered. But then when they go to enroll, they learn that they're outside of an enrollment period. These new flexible special enrollment periods will be available to help those folks too, and we can walk people through the process because it is confusing, these different dates and when things start. The good news is that the enrollment periods will be more generous, they're more lenient, and people will be able to access coverage sooner. So, after 40 years, we can all celebrate that these changes are finally happening.
And are there other changes? I know I heard something about insulin, for example.
Yeah, that's another very important change that's coming for 2023. It was through the Inflation Reduction Act that was passed in August. Really, really important and really big news. And some folks might have heard of it already, that insulin will be no more than a $35 copay, and it will not be part of somebody's drug deductible. So it will not count towards the drug deductible. And all insulin, we've been fielding a lot of questions on this here at the state level. A lot of people have been calling, and insulin, this was one of the things prior to this change that was so costly for folks. I mean, it was difficult for them to find a plan that worked for them. Many of these individuals who were on insulin, and the costs were just so high. So this is so important. If you do take insulin, no more than $35 copay. That change will be effective January 1st. The other thing is no copay, no deductible for vaccines, and vaccines will be covered under the Medicare Part D. And this includes the shingles vaccine, another very big important change for 2023. Again, these were all outlined in the Inflation Reduction Act that was passed in August. So lots of good news there as well.
So, Fred, Heather, you know, what are people's number one takeaway in your opinion? And did I not ask you a question that you wish that I had? So I guess it's two open-ended questions. There's a lot of information here. And when we do these types of things, what we're trying to do is provide the info, but more important, or equally as important, but I think more, connect to the appropriate resource. You can't remember all the nuances and intricacies of all of these things, but if there's a place to go, which there is, to get them there. So two open-ended questions. Is there something you want to reiterate or that I didn't ask? And what's the number one takeaway for the audience today?
You know, well, Greg, for me, what I want the audience to walk away with is, we know that every Medicare beneficiary in New York State has healthcare costs, and we live in a great state that supports older adults and has benefits to help you. And so if you have Medicare premiums, if you have drug costs, if you have healthcare costs, I just want everyone to consider being screened for a program to help lower your costs, because we have the Medicare Savings Program, we have extra help, we have our state pharmaceutical assistance program that's called EPIC, and we have a number of other programs through the State Office for the Aging that can help older adults. And so if you've even never asked for help before, just consider, you know, reaching out and saying, I want to check this out and see if I'm eligible. And even if you're not eligible, I bet you that you know somebody who is eligible. And so I think for me, that's the main takeaway for 2023, is know that these programs are out there and try to take advantage of them.
Heather?
Yeah, and for me, Roger, I don't know if you can flash our information up on the screen if you're able to, but for me, I just want to say, you know, I've worked on this program for several years here at the state level, and I also worked at it at the local level. And it just always amazes me, you know, folks who reach out and some of the complexity of their situation and their issue. And our counselors, our volunteers throughout the state really provide such one-on-one, deep level counseling with these individuals related to their situation. I mean, some of these calls we get in some instances can be very heartbreaking because it's dealing with people's health insurance, their prescription drugs, their access to a provider. And I can't tell you how dedicated these counselors and volunteers are throughout the state that help these individuals. So as Fred said, if you're somebody who you're sitting there thinking, I'm just not so sure, my premium went up, what might I be eligible for? Is this really the best plan for me? Give us a call, 1-800-701-0501. Reach out to us. I know, as Greg mentioned before earlier, you're inundated with information right now, but we are the objective, unbiased, free source that you can go to. And let me tell you, these counselors that are working at the local level are so dedicated. We really couldn't run this program without them. So.
And I appreciate both of your sentiments. And I'm going to just kind of close on more of a philosophical, right? We're in a difficult economic climate right now. Prices are going up all over the place. And even a couple of $100 really makes a difference. So, I'm going to just ask all the homeowners out there, how many of you received the STAR property tax benefit? And probably the answer is close to 100%. Or if you were sending your children to college, would you accept a TAP or a Pell Grant to help finance that? The answer, of course, is yes. If you ran a business and had an opportunity to get a reduction in taxes in order to beef up your business, would you do that? Of course, the answer is yes. But then we talk about things like this, and people are reluctant to take advantage of exactly the same types of policies and programs that help others. People are reluctant to do that. You don't have to do that here. By making the phone call and even matching up the right plan with your needs, that can save you money. And then the data that Heather and Fred talked about with Extra Help and MSP and Epic can further put more real money in your pockets every single year. And I'll throw one more out there. The SNAP benefit, food assistance, is worth $3,000 a year. So those are things that can help in this environment, but these are all things that, again, you may not have needed at one point, but may need now, and it's okay to reach out. That's what they're designed for, and that's who they're targeted for. So Fred, Heather, I'm sure you're going to be getting a lot of questions and a lot of phone calls, but that's exactly the point. They should not be going to a for-profit entity who's trying to sell their own service. We should be getting people the information they need through a large New York State network of dedicated, objective people who are going to provide and walk folks through what's really in their best interest and answer individualized questions. So I just want to say, Fred, thank you to you for the person you are, the organization you run, your longstanding partnership with the New York State Office for Aging, and Heather, who does a remarkable job in overseeing not only a staff here, but 59 different projects and programs across the state, as well as folks like MRC and some of the other providers that work with us. Very dedicated individuals on a very, very important topic. So my charge to you, make the phone call or come visit one of our sites and get the information to keep you as healthy as possible and as financially stable as possible. Fred, Heather, thank you so much. Roger, thank you as always for all your behind the scenes. We have a very, very busy November with National Caregiver Month. So we will see you shortly to talk all things caregiver and a variety of other important topics. So thanks again for joining us, and we'll see you next time.
Thank you.
Thank you, Greg.